Hi, I'm Mindy McIntosh, and today I'm here to talk to you about Medicare and the annual election period. And here at McIntosh and Associates, we want to help families just like you cut through the clutter of this time frame that you're open and eligible with this annual election time period between October 15th through December 7th. And what does that really mean? And why is there so many phone calls, TV advertisements, and materials coming in your mailbox? Well, we're going to walk through that together. And being here as an independent firm in Freeland, we have the opportunity to walk through all the Michigan based plans with you to find what's going to be best for you and your family. Now, what is Medicare? Well, when we talk about Medicare as a whole, it is a part of the Center for Medicare and Medicaid Services that provide most people as they turn 65 coverage with items such as three parts: Medicare Part A, your hospital benefits that you're probably more than likely have paid into during your Medicare and FICA taxes through your working years. Medicare Part B, which is other parts of original Medicare, where the B is generally speaking going to pay roughly 80% of your bills for outpatient services that you do. And then we also see Medicare Part C, where it kind of bundles it all together in what they call an Advantage plan, that you'll have copays for medical, a prescription drug component in there. You'll have coverage for things like dental and vision and hearing, as well as maybe some grocery items or over-the-counter benefits and that fitness package all in one plan. In addition, there's also just a standalone Part D or prescription drug. So as you can see, there's already several different components to how we take a look at Medicare. So your initial enrollment period, so anyone who is eligible for Medicare either needs to apply or will be receiving this red, white, and blue sample card in the mail. Now, generally speaking, most of you are eligible within that 65 birthday timeline, where we're either looking 3 months prior, the month of, or up to 3 months after you turn 65 to actually apply during your initial phase to be eligible for Medicare itself. Now, some of you are going to continue working for an employer past 65. So depending on if you have credible coverage and the size of the employer group, you may choose not to apply for Medicare quite yet. You also may not be drawing Social Security, and if you're not, we can walk through the steps of how you'll actually apply for Medicare. And those of you that are already drawing Social Security and you're turning 65 and you're ready to enroll in Medicare, this card will show up automatically to you, and then the choices begin of picking your appropriate plan that fits well for you. This year talks about the different portions provided through the federal government of Medicare itself. So as we said, Medicare Part A is what you've paid Medicare and FICA taxes into. They have deductibles and daily copays if that is the only coverage you have. And those are things like hospital bills, skilled nursing facilities. It's going to be anything in the hospital setting. We're also going to see Medicare Part B on the flip side of things that you actually do have a monthly premium for based on a standard rate. And this does change every year. And if you're still a higher income earner, or you have an income related adjustment to Medicare, meaning that you're earning over a certain threshold, then your premium portion that you pay to Medicare does go up. And we can cover that on a more individual basis. But this is going to cover about 80% of things like doctor visits, outpatient lab work, physical therapy, anything done outside of the hospital setting. Original Medicare is those two original parts. So now what would come next? Once you secure Medicare, depending on your own timeline, which is personalized, then we look at, do we want to take a Medicare Advantage that helps give you coverage alongside of A and B and give you the prescription coverage and medical and dental and vision and bundle it together with one of the insurance carriers? Or do we just want a standalone prescription card to kind of work in underneath of Medicare and then add a separate supplemental or a gap plan to that? And these are all decisions that we would walk through. When we take a look at options, well, many folks get their Medicare coverage in one of two ways. Many different options within them, but there's kind of a left and a right, two different pathways that you can pick from. And as you can see, once you've established original Medicare, your A and B, and you have that solidified, then you can pick a Part D standalone prescription drug plan based on the medications you use, the pharmacy you use, and that should be updated and reviewed on an annual basis as formularies change and so do copays within the various carriers. If you go that route, then we go ahead and help you get placed into a Medicare supplemental plan, or some folks call them a Medigap plan, that we purchase from an insurance company. And we look at, this is where there's the alphabet soup. So most folks like what's called a Plan G, where your 20% is now covered by your insurance supplemental plan, and you only pay the calendar year deductible of Part B in that given year. The other option is to go with a Plan C. You still have original Medicare, but now you have a bundled plan that's going to give you your medical copay, your prescription drug, the dental, vision, and hearing all in one plan, which is very low cost, generally speaking. So instead of having a supplement and a Part D card, and then maybe adding some other components for dental or vision or other ancillary benefits, you can choose to do a Medicare Advantage and put them all in one. Again, we still want to look at doctor usages, what physicians you use, how much do you travel, what medications that you're taking, and other factors such as income and in other items as far as daily needs go for you. Here, Original Medicare talks about the different costs. So this talks in about this current year in 2022, Medicare itself. We do not want you to just have Medicare or let the confusion think that, okay, I have Medicare A and B, I'm all set. Because with just Medicare A and B, you do not have any prescription coverage at all. And then you will have this $1,556 deductible from Medicare for any hospital type of benefits. And you have an open-ended stay. So when you go into the hospital, I hope none of you stay more than 60 days, but if you do, you have over a $300 a day copay there. Plus skilled nursing care, as we talk about this period of time, if you need skilled nursing care for more than 20 days, you then are paying about $195 a day for that skilled nursing care. And once you hit 100 days, you're going to pay 100% of the bill. So we want to look at those gaps and help to kind of round out your exposure. And then the Medicare Part B, you are going to pay anywhere between $170 all the way up to the high $500 range, depending on your income. If you're a high incomer or you're trying to do tax planning and you're doing, let's say, Roth conversions and such, that pushes up your income and it has you pay more for the cost of Medicare. Medicare Part B this year also has a $233 calendar year deductible. So once that's been satisfied, Medicare is then going to pay 80% of your medical claims, where you are left with the 20%. This is why, as you see Original Medicare, we have no prescription drug yet, and also unlimited exposure on some copays and out of pocket, which means it's super important for us to take a look at narrowing down and deciding what plan fits well for you. Our office is happy to help you with that. We do so in various ways. You'll be able to schedule a visit through our website at wealthmichigan.com. You can call our office at 877-222-8849. And you'll see in here that there's just different ways to connect for a visit to walk through that. Because this is also personalized as we talk about that range in the Medicare Part B costs that you'll be paying. And if you're drawing Social Security, it will come right out of your Social Security paycheck. And if you're not, this is something that this bill would be mailed to you on a quarterly basis. So in 2020, you have a 2-year lag time. So if you have Medicare in 2022, it's going to go back 2 years and take a look at what was your income in 2020. And depending on what the income was in 2020, let's say you're married filing jointly, if it was under $182,000, you'll pay the standard rate of $170.10. But let's say your household income was $300,000. You're not paying $170 anymore. You're now paying $442 plus a Part D increase of about $50. So I think several $100s a month is a big change that I want to make sure that you're aware of and that we can walk through those steps together. Here, this talks about, well, what is the Medicare supplemental policy? And why can I buy a Plan G and Plan N and Plan L? And what are all these plans? So they are standardized as far as the coverage goes, offered by various independent insurance companies. But whoever then accepts Medicare will accept your supplemental plan and allows to be portable with you through the insurance company, paying that 20% on average, and just possibly some of the plans have copays or a deductible to reach in the plan, but it covers very well those gaps. Option two that we spoke about was using a Medicare Advantage plan that kind of bundles it all together. If you want something that's kind of a one-stop, you can have one insurance card for your prescriptions and your medical, and you'll see that you'll get other traditional benefits, some dental, which I know that the cost of dental care is on the rise as well, and vision and over-the-counter benefits. So if that's a fit for you, we would walk through some of the value adds possibly that might fit for you in how much you're doctoring and medications that you might take. This year just talks again about important days to remember. It's very, very important. For those of you that this is the first time you're looking at Medicare, you're going to turn 65, you're looking to retire, I'm happy to visit with you. Others, you might have been on Medicare for a number of years. I still encourage you that whatever you have for coverage, let's make sure that we review it. Let's talk about doctors. Maybe your plans have changed for some travel next year. Let's talk about maybe your physician could be retiring, or just even re-looking at the formulary changes from year to year on both the pharmacy and the medications that you take, and make sure that that's still a good fit for you in the 2023 season. Well, where do you start? Well, to get familiar with rules, there's a couple of different ways that we can help families as they're looking at options into the 2023 season. So you can see here that we want to make sure that we can provide and take a look at out-of-pocket costs. We want to make sure we can provide and review too for you. Some of you are already receiving this annual notice of change, it's called. If you don't want to have to look up all your formularies and see which prescriptions have changed, please rely on us. I have a tool that we can utilize. Type that in for you. You can see your medications, what tier they fit in, what copays you'll be paying. You'll see if you are in any danger at all of hitting what's called Medicare's coverage gap, and we make it very easy for you all on a nice piece of paper that you can take a look at and see those options that you have. So that's very important when we come into play with looking at out-of-pocket costs and trying to reduce the cost that you have. You're also going to see that the new ruling, though, some folks are asking about, hey, does this mean my prescriptions are going to cost less? Probably not until 2024 when they're trying to help you with those copays and the cost of the prescription drug from the recent ruling that we've seen. You're also going to see, well, what questions should you ask? I'm wondering, and what I'm questioning you on is, has anything changed for you over even the last year? Not only are you aging in and turning 65, but are you looking to retire in the next year? Have you had any changes to the medications you're taking? Have you felt like, am I really paying more than I should? And my friends are talking to me about some other benefits that I just don't know if I'm eligible for. I would like to have a conversation with you to run through what those actually look like. And what about the fact of, hey, do you feel like your dentist is in a network? And what types of dental insurance might fit best with your dentist that you might not want to change if you've had them for 20 years? And how do we look at other indemnity type product plans of things that might be important to you, like how do I get extra benefits for cancer? Or if I go into the hospital, can I provide some added protection to my family to secure things that are important to you that maybe you're walking through or you know a loved one that has, and let's go ahead and discuss it. I think some of the big things too about comparing and being prepared is we always tell our families that we work with having a plan is so important. So I think it's important for you to spend some time on your health care and on your needs, just like you would to go see your specialist, so that we can review and ensure that you understand well what you have and you're making the best informed decision for yourself and your family moving into the 2023 plan year. This talks about things like, what if you did want to have a coverage so that you don't have a stroke, because you've heard of some families that have and some other friends, or a heart attack, or it could be that cancer risk, or maybe you're very, very healthy and you're just wondering, hey, what should I look at next year? And maybe things have actually changed in your medical journey. We are here to help you walk through any and all avenues of that for you to review what plans you have and do some comparisons for you. And none of these changes will take effect until January 1st. So yes, we must visit between October 15th and December 7th, but all the effective changes would take place January 1 of 2023. Clean slate, new copays, possible new out-of-pockets. It's a good time for a transition. So what are your next steps? If you are watching now, please schedule a visit. If you thought anything that I said here, that's a good point, or I haven't thought about that, let's schedule even just a 30-minute visit together to walk through what it is that's important to you. And we'll go detailed into your own situation, review that, and help you walk through that plan. And all of that, too, for you is not going to actually cost you anything. You are going to be able to visit with us. You're not going to pay a consultation fee or a visit fee. We'll make it really warm and inviting. And I look forward to talking to you during this open enrollment.